Welcome to Dr. Dale, your go-to animated channel for simple, fun, and reliable health tips. From common illnesses to wellness hacks, Dr. Dale breaks down complex medical info into easy-to-understand animations. Stay healthy, stay informed, and don't forget to subscribe for your weekly dose of health made simple. Let's proceed to our today's crystal concept. Hello, this is an explanation of NSAIDs, a common type of medication used for pain, fever, and inflammation. What does NSAID stand for? NSAID is an acronym. It stands for non-steroidal anti-inflammatory drugs. Let's break that down. Non-steroidal. This means they are different from steroid medications, which also reduce inflammation. Anti-inflammatory. This is their primary job, to reduce swelling and inflammation. Drugs. They are a class of medication. How do NSAIDs work in the body? To understand how they work, let's talk about two key enzymes, COX-1 and COX-2. Your body uses these enzymes to produce chemicals called prostaglandins. Prostaglandins have different roles. Some, mainly from COX-2, cause pain, fever, and swelling when you're injured or sick. Others, mainly from COX-1, protect your stomach lining and help your kidneys and blood clotting function normally. NSAIDs work by blocking both the COX-1 and COX-2 enzymes. By stopping these enzymes, they reduce the prostaglandins that cause pain and inflammation. This is their therapeutic effect. Common uses for NSAIDs. Doctors often recommend NSAIDs for conditions such as headaches and migraines, muscle aches and sprains, arthritis, pain and inflammation, menstrual cramps, fever, minor back pain. Examples of common NSAIDs. You can find many NSAIDs over the counter and by prescription. Common ones include ibuprofen, found in brands like Advil and Motrin; naproxen sodium, found in brands like Aleve; aspirin, which is also used in low doses for heart protection. Important risks and side effects. Because NSAIDs block the protective COX-1 enzyme, they can cause side effects. The most common are stomach issues. This can range from indigestion to ulcers or bleeding. Taking non-steroidal anti-inflammatory drugs with food can help reduce this risk. Kidney problems. With long-term use, they can affect kidney function, especially in those with pre-existing kidney conditions. Increased blood pressure and fluid retention. Higher bleeding risk, because they can thin the blood. Key safety tips. To use NSAIDs safely, remember these points. Use the lowest effective dose. Use the smallest amount that relieves your symptoms. Use for the shortest time. Do not use them for prolonged periods without consulting a doctor. Avoid if you have certain conditions. Be cautious if you have a history of stomach ulcers, kidney disease, heart disease, or are on blood thinners. Do not mix NSAIDs. Avoid taking different NSAIDs at the same time. Consult a professional. Always talk to your doctor or pharmacist before starting any new medication. Conclusion. In summary, NSAIDs are powerful tools for managing pain, fever, and inflammation. However, they are not without risks. Understanding how they work and following safety guidelines is essential for using them effectively and safely. Thank you for listening.